Welcome back to another episode of the AskIAR show. I'm Toko and I got Ben with me today. How you doing, Ben?
Doing great. Happy to be doing another program.
Awesome. We got a great show for y'all today. We got some information that I think everybody can relate to, no matter how much experience you got out there. So let's take the question. It's from Jennifer, right? Go ahead.
Yes. So this question is from Jennifer in San Antonio. Hello, my colleague is currently completing an IAR now, and he said you guys would be the best people in the biz to talk about a challenging patient I have. I'm working with a recreational runner. I'm seeing him for anterior and lateral knee pain that has been present for approximately 3 weeks.
Okay.
He's an experienced runner and has no real history of knee pain until about a month ago. He has not changed his normal routine at all. His symptoms are improving, but a lot slower than I would like. I've been working on his hip control and some mobility issues in his knee and foot, and a couple of visits later, I actually worked on his low back because I wanted to make sure that his pain was not nerve related. I added in some core strengthening exercises, I added in some stretching, mainly calf and hamstring, just to cover all my bases. I think he's getting better, but not as fast as I would like.
Yeah.
We spend a lot of time discussing his condition, a lot, but he's not compliant with taking my advice on activity modification. This is so frustrating. Please, please, please help.
Okay. Great question, Jennifer. Thank you for asking. It doesn't sound like your approach is the issue. It sounds like you're taking a comprehensive approach, so I don't think that's the problem. I would have to ask you if you feel like the patient has complete confidence in you and complete confidence in your approach. The reason why I ask is because typically with non-compliance issues, that usually goes back to patient confidence in the clinician, which is typically a direct reflection of the quality of patient education. So when we have compliance issues, I have to ask myself, is my patient education, is it quality? Does the patient understand what I'm saying to them? But more importantly, am I coming off as an expert?
And I think that's the key word, Toko. To be an expert is not to just be knowledgeable about a patient's condition, but it's also being able to convey that knowledge to the patient. So, case in point, I was actually doing some mentoring with one of our clinicians recently, and after we acquired the subjective from our patient, we broke aside and we were just kind of chatting about what's going on.
Yeah.
So this clinician could not have been more dialed in to the cause of the cause, what they wanted to do to treat this patient.
Right.
But when it came time to circle back to the patient, that's where everything kind of fell apart.
Yeah. What happened?
Well, for one, this is somebody that's usually very, very confident on the sidelines,
Yeah.
my colleague, but once they were sitting down with this particular personality, they just kind of crumbled. So there was an extreme lack of confidence. There was a visible frustration and confusion on the patient's behalf. And in this case, I think that although they knew what was wrong with the individual,
Mm-hmm.
they didn't know how to convey that as it would be best received from that person, really as it was related to their goals.
Yeah, good point. I know in the past I've been quick to point the finger at my patients when they are not compliant, but I think with all things being equal, and at the end of the day, I need to shoulder some of that blame on myself, because most likely somewhere along the line, I probably dropped the ball on patient education. So again, like what Ben said, coming off as the expert, knowing and understanding the patient's condition and what's going on with them, that's only half the battle. I think quality patient education and the ability to recognize how best your patient receives information, that's key. And that's key into compliance and, at the end of the day, getting these guys better, whether they're athletes or not.
Yeah, and I think that's a good point. When it comes to patient education, it's a skill, just like anything else we do as clinicians.
Right.
And as a skill, it's going to require practice. It's going to require rehearsing. So I can't tell you how many times I've actually dropped the ball and, reflecting about it later on my drive home. I was like, how could I have modified what I said to connect with that patient, right? And I think it comes with rehearsing. So there's times when I rehearse to myself, but we would encourage any other colleague practice with your cohorts, you know, practice with your mentors, call us up, bounce ideas off us on how you think something would be best said. But I think the bottom line is you can't fake it until you make it. All right, you cannot fake it. You have to have the knowledge, but also know how to convey that knowledge so it's received in the best fashion. So I'd say learn it and earn it.
That's a good point, Ben. Jennifer, I hope that helps. Hope that helps with your question. Again, if you have more questions, shoot us some. We're available by email. We look forward to hearing from you again.